Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yunji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser. This episode of Spotlight Hawaii is brought to you by Chaminade University.
Well, happy Aloha Friday, happy Admissions Day. Thanks so much for tuning in here on this Friday as we end this week together. My name is Ryan Kalei Suji, joined by Yunji Denise, and this is Spotlight Hawaii. And Yunji, today we have a guest that always gets a lot of questions and a lot of attention.
That's right. He's in charge of the Safe Travels program along with the state's vaccine rollout, and he's joining us live from his office at the state capitol. We want to welcome Lieutenant Governor Josh Green with us this morning. And Lieutenant Governor, we just saw the numbers from the Department of Health, another really high daily count.
Yes, 845 today. The surge continues amongst our unvaccinated population predominantly. It's still about 97% of all cases among those who are not protected by the vaccine. And of course, that has its consequences. When we've had an average of 661 cases this last 7-day period, that count has accumulated. We now have 8,842 active cases in the state, and that will mean more hospitalizations, which I'm sure we'll talk about. We have to get control of this through vaccination. Otherwise, it will, of course, wreak havoc on our population.
Let's talk a little bit about that hospitalizations. Earlier this week, we talked to representatives from the Hilo Medical Center as well as the Queens Medical Center, both saying that, sharing the challenges of the capacity issues that they're seeing. And one of the things that they did note is the scary part is that all the challenges that they're seeing now, they expect it to get worse. With the surge that we're seeing now, usually there's a 2-week delay in some of the patients that they end up seeing within the hospital. So with the large numbers that we've been seeing this week and even into last week, some of those have not even been received by those hospitals yet. What is the state doing to anticipate that number given the capacity limits right now of the hospitals in the state?
That's a perfect question. So yes, they're correct. We have to have more support. We have 550 individuals coming into the state, mostly critical care nurses and respiratory therapists or respiratory techs to help with ventilators. That 550 people will accelerate. Last week, we got our first batch. This weekend, we get our second large batch. So they'll be on the floors by Monday taking care of patients to help spell our teams. Just to give you kind of an overview of where we are with the hospitals, at 8 in the morning, when I finished my first round of counts, we were at 371 individuals hospitalized for COVID. By 9:30, when we were done talking to the Healthcare Association, we were up to 300. Yes, and 81, up 10 more. So 381 individuals in the hospital, and all but 38 were unvaccinated. So 38 people vaccinated, exactly 10% of the 381 people that were in the hospital with COVID. We also had 4 fatalities yesterday, and we have over 50 people in the intensive care units on a ventilator, where 50-50 chances are that you will die. So we're bringing those extra teams out to all of the hospitals. I think 19 of our hospitals are getting some of these extra personnel, and it will be life-saving. We won't go down the road that other countries and states went of absolutely turning our backs on anyone. We won't do that. We will take care of everyone who comes with COVID and with other ailments, but it comes at a cost. The cost has been that we have to stop doing elective procedures. For example, and I've shared this with others, for example, a woman got in touch with us through a friend. She has breast cancer. Her mastectomy to remove that breast cancer has been delayed because she can't get the surgery because the hospital doesn't have the capacity to do it. They will not have the ICU bed for her recovery. Another individual that I care for personally, which was last weekend, had a heart attack. 74-year-old without COVID, fully vaccinated, but there was nowhere to send him for many hours. Ultimately, Queens was very gracious and was able to accept him after many hours of me taking care of him on the neighbor islands. So these are the collateral realities of having a surge in the hospital and a surge in the state. So anyone who's not vaccinated needs to know that if they catch COVID and are among the 4.5% of all people that get hospitalized, they will be, of course, cared for professionally, lovingly, but they will be taking beds away from people who have car accidents, who have strokes, who have heart attacks, and that's not necessary. If we had been fully vaccinated at 95%, say, leaving only 5% for people who have serious philosophical or religious reasons not to get vaccinated, you and I would be talking about 20 people in the hospital and maybe 30 total cases across the state, new cases. Instead, we're talking about 800 cases plus, and we're talking about 381 people in the hospital. That's the reality.
That breast cancer case and the gentleman with the heart attack, I mean, those are very serious consequences. I want to bring in this question from Chase, and it's one that we've been getting a lot of messages to ask you about is, do you think more needs to be done as far as restrictions? Is there, there was a medical professional in Louisiana who gave a news conference, and she said these are the darkest days of the pandemic. Do you think that's the case here in Hawaii? And if it is, why are we not having more restrictions?
Yes, these are the darkest days of the pandemic for us. It is an extraordinarily challenging question. So I do think we should do more. We definitely need to be restricting all large gatherings, period. They can't go on. We'll have to enforce that in any way possible. But let me break this down a little bit more specifically. We have a lot of people who have become vaccinated. In our population, we are now at 994,000 individuals who have at least initiated the vaccination, if not completed it, out of the 1.2 million citizens that are eligible to get a vaccine. So essentially 1 million out of 1.2 million people, which is 82.9%. So 82.9% of our population have done what's right, which is to protect themselves against severely ill, leaving just 17% of the population who has made a choice for themselves to not get vaccinated and be protected against the Delta variant of COVID. That 17% is seeing COVID rage through it. In many cases on the western side of Oahu, where our vaccination rate is like 35%. Because of that, there is a large debate that goes on behind closed doors, and people ask, and they ask this openly, is it fair to shut down all of society when 83% of the people have chosen to protect themselves and their families and their community? Is it fair to shut every business down and make people go bankrupt? Or close schools when our children need to be educated? You can make a compelling argument that is simply not fair to all those individuals that have done the right thing and won't get severely ill. The problem, of course, is the hospitals are full, and therefore you could be fully vaccinated like that gentleman who had the heart attack. He didn't deserve to have a situation where he couldn't get a bed, but because of our actions as a society, it impacted him. So what we're trying to do is we're trying to be fair to people who have made the right choice to protect themselves and their community, and do everything else that we can to support the hospitals. There's no way I can convince the last remaining people suddenly to get vaccinated. We may get a certain percentage of them when the FDA approves the full vaccination in about a week to do it. That's probably our last best chance to get a lot of people vaccinated and on the right page. But I know that there are people out there who say, just shut it all down. But that's a pretty difficult thing to do when suddenly a family who got vaccinated won't be able to pay their rent, won't be able to pay their mortgage, won't be able to pay for groceries for their children, may not have extra unemployment protection. They got vaccinated. They've done the right thing. So that's where the debate really is. And I just wanted to be very honest with you about the debate, because these are extremely complicated questions. And I would finally say this about schools. A lot of people are saying, well, you got to shut down schools because kids could get sick. I completely agree that we have to be concerned. I have a 10-year-old, Sam, in public school, not vaccinated because he can't be vaccinated yet. But are we really going to stop kids from getting educated where they often get their nutrition, their best meals of the day, all of their developmental milestones met, because this 17% of the population has chosen not to be vaccinated? It's a really tough call. But at the end of the day, if there are outbreaks in schools, we'll have no choice.
One of the things that were floated around, and I believe you suggested at one point in time, was a possible curfew that would go into effect. Can you explain a little more about what that would look like? Would that mean that everybody would have to just stay home at a certain point in time, or would that mean more businesses would have to shut down by a specific time? If you can expand a little bit more about this thought of a possible curfew that might help with these rising numbers.
Sure. So this is a pretty challenging proposal. Now, the reason for the potential proposal, and it would probably go into effect like after midnight, so people wouldn't be on the roads unless they were going to work after midnight, is because at Queens Hospital, our main trauma center, when they're full in the ICU, they were seeing between 8 and 11 large traumas a night. And at nighttime, we ER doctors often say nothing good happens after midnight, which is to say people have their drunk driving accidents, people stab each other, sometimes there are shootings. It's almost always when people are high or drunk late at night. So when Queens can't adequately deliver the care at the highest standard that they're accustomed to delivering because of those accidents in the wee hours of the morning, a curfew gets recommended. And that's where that came from. It wouldn't significantly decrease the numbers overall, but what it would do is it would protect those rooms and those teams that deliver the healthcare and those ICU beds so that they would be available the next day for whoever came in with COVID, who is having respiratory problems because of COVID and so on. It would probably affect bars and strip clubs, which I'm not particularly worried about at present, because I'm much more worried always about whether or not individuals can get health care. And that's really what goes on after midnight. So these are societal challenges, right? And I'm not trying to make light of those industries. I know how they've been hurting. I know how bars and restaurants and everyone's been hurting. But at the end of the day, can you imagine if your teenager was hit by a drunk driver and he or she couldn't get trauma care because Queens had no space? I mean, these are the challenges we're now facing because of the extreme numbers. And I'm going to continue to fight in every way to make sure our hospitals are supported until we get through the end of this surge, which it does look like will be at least 4 to 6 weeks of high numbers in the hospital.
So that curfew idea, is that something that's actually gaining traction? And if so, when would it be implemented? And are we talking like midnight to 5 a.m. or what are we looking at specifically?
No, I don't think it's taking hold. I wouldn't mind having a curfew for Ryan. But other than that, I think we're probably not going to have a curfew right now, because I don't think that it's the most consequential policy change we could make. If we were going to make a consequential policy change right now, and sorry for teasing you, Ryan,
You're fine.
You're our young sexy host, okay? If we were going to do a consequential policy change right now, it would be to make sure people have to have a vaccine demonstration, their vaccine cards, to go to restaurants, to go to bars, to go to exercise clubs, fitness centers, and so on. That's what they're doing in New York. That's what they're doing in San Francisco, and that would prevent spread. So we are working up that policy and giving that as an option to the governor.
You know, one of the other areas of just concern has been the pre-travel testing and the Safe Travels program as a whole, with the vaccine verification that has been also allowed. We're getting a lot of comments about this right now, asking why the state is not re-implementing that and doing away with this vaccine verification option and just making everybody test before coming back or coming into the state. Could we expect to see any changes being made to the Safe Travels program?
Well, I'm really glad you asked. So look, I was the architect of that program. So needless to say, I'm a huge supporter of it. It worked very well for us. The reason it hasn't already been re-implemented, in other words, making everyone pre-test before coming, is because the CDC has given us a ruling, a national ruling, that travel, if people are vaccinated, is safe. Therefore, after talking to our attorney general and other lawyers on our team, they tell us it won't stand up in court. It's really that simple. Now, having said that, re-implementing a pre-test would do a couple things. It would catch some cases, there's no doubt about it, and that would be helpful, but that's not where the largest problem lies. 1 to 2% of all of our cases are coming from travelers. About 12% of all of our cases are coming from residents returning who are unvaccinated and refusing to test. Remember, we're not allowed to legally demand a test. All we can legally do is put people into quarantine. So that's the problem. Now, the CDC, the FDA, they're basically at the federal level telling us that we can't keep that kind of a program and sustain it in court. It goes beyond that, though. We have to focus on the right things. The right thing is stopping community spread. That's where almost all of the transmission of this disease is occurring. And people just unfortunately have to wrap their heads around that. All of the focus on travel really, unfortunately, confuses the larger matter, and it distracts us. The distraction ends up costing us a lot of chance to stop it with vaccines and stopping the spread through events, through gatherings. So as much as I would like to see that pre-test back in place, it's difficult. Now, it would have one effect. If we wanted to test the courts and see if people would sue us, it would stop travel probably by about 15,000 people out of the 30,000 people that are coming, because they would just say it's too onerous right now to travel. They would not be able to find a test because there's a big surge on the mainland. So with fewer people coming, there would be fewer people working and interacting with one another. And so case counts could come down. But the costs would be, of course, poverty would rise, people would not be able to pay their rent, and so on. These are the great challenges we have. The only real successful thing we can do is absolutely vaccinate people or convince them to get vaccinated, either because they listen to their doctor or nurse or because the FDA approval incents them to get it. That's the one big thing we can do. The other thing we can do is we can really self-assess and not have any gatherings if we're unvaccinated. Unvaccinated gatherings are absolutely spreading this disease.
I want to bring in this question, and that is, what is the status of the isolation quarantine hotel facilities and who's eligible? How do you receive these services? You know, you talked about community spread. Of course, getting vaccinated is a huge tool. Another tool, of course, is self-quarantine and isolation if you've been exposed or if you have active COVID. But we know that Hawaii is, if not the most state with the most generational households, it's top 5. So are there enough facilities available for those who may not have the resources in their own homes to self-isolate?
There are a lot of facilities and beds, but they're all full, because with 8,842 active cases, that system is totally overwhelmed. And there aren't a lot of hotel rooms either. And as you know, Airbnbs are not the answer in this case. It's not going to happen. So we don't have enough capacity because of the high number of cases. I know this ended up being the refrain today, which is because we have too many cases, we don't have actual access to care in the hospitals or access to isolation quarantine. We really are maxed. And that means that we are going to have to ride this out. And those who have caught COVID are going to have to do the best they can to quarantine safely in their own home. If they have any shortness of breath, that's the time to call 911 or go to the hospital. Otherwise, the only thing we can do is be smart. And by being smart, I mean either getting vaccinated or staying away from gatherings. There just aren't enough ISOQ beds. We have now a large part of our population that are actively COVID positive. There is a little bit of, hope on the horizon, and that's that we're building up immunity quite rapidly. And we have not seen many sick kids. There are only 2 children in the hospital, one 17 years old and one I believe is 4 years old in the hospital. Neither one is intubated, in spite of the fact that we have 381 individuals in the hospital. So we're not seeing a surge like that just now. And that's something.
One of the other areas that we saw early on in the pandemic is the preparation for a possible field hospitals, if you will, the convention center being turned into a medical facility to deal with the overload, the National Guard getting involved to assist in those measures. Due to these high numbers that we're seeing in the hospital and the capacity issues, could we see these types of facilities being set up anytime soon?
We could, but it's unlikely. We do have. Here's how we break it down. We've got about 3,200 hospital beds in the state. We typically use about 2,200 of them. That's what we staff with our current staff in the whole state. So that leaves somewhere between 800 and 1,000 physical beds that can be quickly utilized for either kind of low-end COVID care, where people are just getting supportive care, all the way up to the highest end where they need ventilator support, like in an ICU or in a surgical operating room that's converted to an ICU bed. So we have that physical space. What we haven't had is the nursing capacity and the physician capacity. So that's why we brought those physicians and respiratory techs and nurses in from the mainland to Hawaii. To build out a facility, it's about $300 million. That would be if we had months and months of high numbers in the hospital and that our actual physical facilities couldn't survive. We also gamed out turning hotels into makeshift hospitals. And we have some portable hospitals that are kind of quickly constructed through the National Guard that could be implemented long before we'd have to do it at the convention center. So I don't think that's on the horizon for us. I actually think we'll be able to make it through with our physical structures.
Linnell has a point here, and I want to put this in here because it's something that I've been hearing a lot. And she says people can still transmit and get COVID when jabbed. I think that and this is just my opinion, that we have set the expectation, the mistaken expectation, that somehow the vaccine makes you bulletproof. And I wonder if you can address this question, because people hear about breakthrough infections and they say, well, then why bother getting vaccinated? I can still get COVID. Can you answer this point, please?
Yes, it's a very good and important question. First of all, if you are vaccinated, then you will not be subjected to severe illness. So almost no one dies from COVID if they've been fully vaccinated. 99.999% of individuals will survive COVID, even if they get a breakthrough case having been vaccinated. That's the first thing. Now, what she's saying is there can be some people who catch COVID enough to have the virus replicating in their upper respiratory tract, their nose and throat. And that is the case. Now, they will not have symptoms of any consequence, but they could spread it. That's why we still tell people to wear masks indoors. If you're unlucky enough to have that virus seeded into you, even though you've been vaccinated, then you could spread it. But think about it in this way. Let's say you're a family of 4 and everyone has had the opportunity to get vaccinated. Even if someone ends up being a carrier for the Delta variant, they're not sick. They're not really a threat to anyone else, because anyone who does end up carrying the virus in that household is not going to get sick enough even to probably have symptoms or go to the hospital. If, however, you have one of your kupuna in the household, the parents have gotten vaccinated and one of our kupuna has not, and say maybe there's a child in the household, the multi-generational household that you described earlier, and there's a 7-year-old. Well, that carrier status could affect the 7-year-old. They could catch the Delta variant from that carrier, as could our kupuna, their parent. And that would, of course, be very dangerous. That elderly individual might end up dying. So that's why, if there's a reason that people in your household can't be vaccinated, you still want to be extra careful. But it's very unlikely. Only 3% of all of the cases, of the 845 cases we had today, only 3% are full breakthrough cases for people who were vaccinated. So I don't want people to dismiss the value of vaccination. They just have to know it's not perfect.
We're seeing a lot of questions here about testing and the availability of testing, that this should be something that the state invests more into, as people comment about how long they're having to wait for getting these testing. Is the state doing anything else to increase the availability of testing on the island? Because we know that there are so many now that are being inflicted with COVID-19, that there is this greater need once again for testing. Is that something that the state is looking into, and what are some of those options?
Yes. So we've more than doubled the number of tests that we do every day now. That's why you're also seeing higher numbers. Before, when we were testing only, say, 4,000 people and you had a positivity rate of 7%, you would have only had 280 cases. Now, when you test 10,000 people with a 7.5% positivity rate, you see what you get. You get 750 cases. We now can test as many as 10,000 people a day. We're doing a lot more antigen tests, and a person with an antigen test and who is symptomatic is considered a confirmed case. And I think that's probably smart and good science. We will continue to increase the testing, because we're also going to begin to authorize more outpatient testing over the counter, where people buy the BD Veritor or other tests from the pharmacy. Those tests are pretty good. The Abbott ID Now test, anything that's over the counter like that, that's been emergency use authorized, approved, is worth including. So I think we're making good strides, increasing the testing capabilities, and it's going to have to keep going up, because we're going to need to test around our schools. And obviously, because the governor and the mayor decided that there would be some soft mandates on people in the workplace being either vaccinated or tested, those tests are going to have to be available to be fair to people. And I think they should be paid for by the state, frankly.
I want to bring in something similar, and this is from Mercy, who says, I drive for public transportation, and if I need to get a shot and show proof, shouldn't the people that ride my bus also be required to show proof of vaccinations? If restaurants can request proof, why can't we? Do you think that there should be wider vaccine verification, not just for private industry, but also for public services, let's say going into a library or riding a bus?
I do. I think that is a smart proposal. And it's one that I've been making with the team. I think that absolutely it's fair to ask everyone to either show that they're vaccinated or that they've been tested, at least for this short period of time. If for the next 60 days we do that, we will see fewer cases.
We know that there is obviously a lot going on at the Department of Health, and one of the areas that needs assistance is that of the contact tracers. With the numbers that we're seeing now, and them having to reach out to all of these individuals who have tested positive, are you concerned at all that we are missing some of these individuals who are falling through the gap, that we're not getting an accurate description and an idea of what's happening in the community because of the strain that's being placed on the contact tracers?
I am. I fully believe that for every case that we're able to catch, there's at least 3 cases that never get tested or confirmed. And that means that there are many thousands of cases additionally that are out there. The good news is that we're still seeing about the same rate of hospitalization day to day. So we would see many, many more people in the hospital if the disease were getting more severe. But it's impossible at this point for the contact tracers to keep up with 8,800 active cases. And if they were to at least trace 10 people per case, you could see what that would look like. That would be 88,000 contacts they'd have to be making daily. And if it was 20 per case, it doubles. It doubles up to like 180,000 people to be contacted. It's just not possible. So right now, it has to be global health. And global health in this case means anyone who has been in contact with someone that they know is positive, they need to be responsible. They need to self-isolate and quarantine until they can get a test. And definitely, if they're symptomatic, not go back to work or back to school. But there's no way the Department of Health during a large surge in any state, not just Hawaii, can manage that.
At the top of the broadcast, you talked about if we had 95% vaccination, the better place we would be in. We have been sort of working toward that 70% of the wider population. That, of course, includes people who aren't eligible, like kids. But what is the sort of benchmark? When we get to 70%, are we going to be in a place where we can drop the restrictions as, had been the goal?
No, I don't think there's any possibility now because of the number of people in the hospital. So we're at 69.5% at least initiated. So in 2 to 3 weeks, we will be pushing right up against 70% fully vaccinated. The CDC will approve the full the FDA will approve the full use of the vaccine.
We lost your audio. Can you try that again?
Yes. When the FDA fully approves the vaccination, I do believe that another 100,000 out of the 225,000 individuals in Hawaii will choose to get vaccinated. That's what the numbers have suggested through polling and discussions. That's another about 8%. So that could get us up towards the high 70 percentiles, like 77, 78%. When they approve the vaccination for ages 5 to 11, we should be able to get another 40 to 50,000 young citizens vaccinated. That's another 3% or 4%. So we can get over 80%. Meanwhile, the rest of the individuals out there are probably catching COVID, and they will have modest immunity. So that's when the pandemic will end. When those individuals who are soon to get vaccinated or can be vaccinated because of the FDA approval, combined with, 845 people have now tragically learned the hard way how do they get to immunity. They're going to be immune soon, as long as they don't get super sick and end up in the hospital. They will be immune. The other people in the hospital will also be immune, but they will face, the severe and dire possibilities of dying from COVID. So each day, I believe about 1% of the remaining unvaccinated population is catching it and getting immunity each day, if you look deep into the numbers. So over the course of 90 to 100 days, and we're well into that, much of our society is now reaching immunity. But it's not, it's not protective for those last few people that have no protection. They've never had the vaccine. They've never been exposed to the virus. Those guys are going to catch Delta.
As we wrap up here, looking ahead to possible announcements that may be coming out, you had mentioned earlier in the broadcast about this possible vaccine verification that would have to be imposed for businesses and restaurants and such. If you can explain a little more about that, when do you think the reality of that could come to fruition? Because I imagine that there has to be some logistical things that would have to be that need to be set up from whether it be an app or something that is developed that would take the pressures off of some of these businesses to have to be the one to help enforce this. What does that look like moving forward? And how long do you think it'll take before that comes online and that is announced?
The soonest I think that could be implemented would be 2 to 3 weeks, although Doug Murdoch is already working on that for the team. So there is some promise there. It's only been about 10 days since the governor put in the new restriction on gatherings, restoring it to 10 people indoors and 25 people outdoors. So usually the governor works in 2-week increments before he makes changes. And so I think that come early next week, there'll be a lot of pressure to continue to enhance the mitigating efforts to stop the virus, especially if our hospital numbers are high. I can tell you that the mayors have each recommended many things. All of them are, good, thoughtful ideas. Some are impossible to implement. Others we need to. So the governor's dealing with all of those things, all that you described, whether or not we add extra testing and test the courts, whether or not we add extra restrictions on gatherings, whether or not we have a curfew. All of these things are in play because the case counts are so high right now. But the most important thing you can do, the simplest thing you can do, is to get vaccinated and do not gather if you're unvaccinated. Those are the absolute most important steps that we can take as society, because if we don't, when we're talking together again in 2 weeks, we'll be talking about a lot of extra people who have died from COVID and continuing high hospital numbers.
It's 11 o'clock, so we know you got to go, but I want to ask this question because George White is relentless in posting it in the comments, and people are saying, ask this question, so please ask. With our high positivity rate, CDC, DOH, DOE policy requires weekly surveillance testing in schools to protect our keiki. Why has the government not made sure this is happening? Do you expect surveillance testing to start in our schools anytime soon?
I do, actually. We're already testing a lot of kids in schools, and we have a program up right now where children or families can request tests, and they get them for free over at our pharmacies. And so that data will begin to roll in, and we'll know in which regions our schools are having the highest positivity rate. It's a very smart recommendation. Surveillance testing was part of my initial rollout of the Safe Travels program, and it was able to demonstrate that it worked. That's why surveillance testing is a smart move in general.
Just before we let you go, is there any final thoughts or words that you have for the audience and those watching here this morning?
Well, I would say this. Keep in mind the impact that we are causing if we're not vaccinated as a people. Remember the individuals that have other health conditions who might be our sisters or our moms. They might have the need for that surgery, like the woman who has cancer and needs to have a mastectomy. Remember the individuals that could be our dads or our grandpas who, have heart ailments and are going to have heart attacks in the next 4 to 6 weeks, but might not be able to go to Queens or Straub to get a heart procedure that would be life-saving. Remember those people when you make up your mind as to whether or not you're going to get the vaccination and protect yourself from COVID. Because if you don't, you'll catch the Delta variant and you'll have a 4.5% chance of being in the hospital, taking up that bed that other people who have been more responsible really need. So please keep that in mind. All of these considerations are meant to keep us all well. I have equal love for anyone who is vaccinated or unvaccinated, whatever choice they make, but the choices are consequential, and some choices are better than others. So this has demonstrated how interconnected we are all as a people. We are truly connected. It's evidenced by what's happening in the hospitals today. So please, everyone, if you can hear my voice today, please get vaccinated or convince your friends or family to get vaccinated, because that's the only way we're going to get out of this without extra loss of life.
Okay, Lieutenant Governor Josh Green, thank you so much for taking all of these questions and for spending part of your Friday with us. We appreciate it.
You bet.
Aloha.
Okay, well, so much to talk about. And, we see all of your comments. We do our best, of course, to summarize and get those questions in there. And Ryan, we did cover a lot of ground. The hospitals are really, it sounds like, at their breaking point. We don't have enough places to quarantine people. He mentioned that there really is not the facility for people, as there had been in the past, to put folks in hotels if they're exposed to COVID. So you really have to sort of lock down on your own. It is a very difficult circumstance. If he had it his way, he said that a curfew would be a good idea, but that does not sound likely. What does sound more likely is this idea of vaccine verification to enter different venues, and that could be coming online pretty soon.
Yeah, he said about 2 to 3 weeks away that there is progress being made on an application that would be required for people to visit different establishments and take the pressure off some of those businesses. But as many people as we see from the comments, many people are asking for something to happen sooner than 2 to 3 weeks. But you heard the lieutenant governor saying that the governor just recently implemented those restrictions on gathering sizes, and he likes to wait, as he said, about 2 weeks to see how things work out and see how the numbers pan. So we'll have to see what the governor does decide, and we plan to ask the governor about that, as well as many other questions, when he will be joining us here on Monday.
Yeah, we've got a really packed week next week. We have the governor on Monday, Dr. Libby Char on Wednesday, and Mayor Blangiardi on Friday. And we hope you all do join us back here then with your questions. We appreciate your passion. The Lieutenant Governor just said that we are going to be in this circumstance in terms of hospitalizations for the next 4 to 6 weeks. So we will continue to bring you leaders here and try to get to as many questions as we can. We hope you have a safe weekend. Be careful out there. If you know someone who's not vaccinated, please have them watch this program, or you can listen to the podcast. Perhaps it can convince some folks who are still on the fence that they need to get that shot, because obviously our community is in a pretty tough spot right now.
We hope you have a great weekend. We'll see you right back here on Monday. Aloha.
Aloha.
This episode of Spotlight Hawaii was brought to you by Chaminade University.